everybody, and welcome to the Dr. Mom Show. It's Dr. D, mom of three. I'm so excited that you're tuning in today for my topic today. Before I get into that topic, don't forget that the Dr. Mom Show is a medical informational resource. It does not take the place of your physician or your child's physician, so please seek out your personal advice from your physician or your child's physician. Before we delve into today's topic, I just want to remind you to check me out at www.delianmushalak.com to follow along with all the exciting projects that I have coming up. The most recent project that is happening right this Saturday, June 6th, is my virtual book launch for Women of War, Peace in the Midst of the Storm. That will be on Saturday, Saturday, June 6th at 10:30 a.m. Eastern Standard Time. Definitely bring your breakfast so you can eat and enjoy the book launch. It is Waffles and Women of War. You don't want to miss out on this great book launch where you get to interact and ask questions to the authors who have helped in this book collaboration. This is an empowering, encouraging, and an impactful book that will change your mindset to help you become a WOW, which is a woman of war. So I'm super excited about that. There will be giveaways and prizes. Who doesn't love giveaways and surprises? I do. So definitely get on there, be on there. Again, that's this Saturday, June 6th at 10:30 a.m. Eastern Standard Time on Facebook Live. Also, don't forget to check out my other recent book collaboration, This Is How I Fight My Battles. You can purchase that book on my website. And then my other two books, my mom devotional, again, that one is out of stock for the hard copy, but it is available on Amazon for the ebook. And then of course my international bestseller, The Trip Season Me, is available on Amazon.com for hardcover and an ebook. So again, today I just want to say thank you. I hope everybody's staying safe out there. There's so much stuff going on. So today I kind of wanted to switch gears and talk about something that isn't happening today, but something that's really important in making a decision and making sure that you make a right decision when it's time to do so. So today we will be talking about how to pick the doctor that is right for you. And I'll be hitting on both a primary care doctor for adults and a pediatrician for kids. So this applies to both adults and kids, and picking out either your family medicine doctor or your internist or a pediatrician or somebody who is awesome and is med peds like yours truly. Got to give a shout out to all the med peds doctors out there. So just a couple of things. So what's important? So number one, first and foremost, you need to look at your insurance. So see what insurance you have. If you're self-paying and you do not have insurance, then you obviously don't have to worry about that. But check out your insurance. You can either call them, call the number on the back of the card, or all the insurances have a website that you can get on and you can find out, look up the specialty if you have a specific doctor you're looking for, and look them up and see whether or not that doctor is in network or out of network, because it changes with the cost of your visit and how much they will cover. So of course you want whatever doctor you're seeing or your child is seeing, you want the physician to be in network, because most insurances will cover that at 100%. Not necessarily. Again, that depends on if you have a deductible and what type of visit it is. So those are all things that you need to look for. Most preventative visits, so for example, physicals, well child checks, are covered at 100%. If it's a sick visit, normally again that goes to the deductible. So again, you have to look at different things of what your deductible is, because usually you have to either pay a copay or pay the full cost of the visit in order to meet your deductible for that year. So again, in network doctors with your insurance, those visits are usually covered a lot more better than your out of network doctors. And now also you want to pay attention if you're in network with a certain hospital or whatever the case may be, and they don't offer a certain specialty. You can definitely find out if the insurance will cover out of network at a lower cost. So these are things that you need to communicate with your insurance company. And again, I just want to reiterate, this doesn't have anything to do with my topic, but I just want to let you know it is your responsibility, it is our responsibility to check with our insurance companies if procedures are covered, if a doctor is in network, if a specialist is in network. It's not the doctor's job or the doctor's staff job. It's your job to know your insurance and to know what they cover and what they don't cover. The next important thing is location. So location, 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 for a couple of reasons. You know, if you have issues with transportation, if you're somebody who has to take a bus or rely on somebody to drive you. Also convenience, you know, I mean, personally, I don't really want to drive like 30 minutes to get to a doctor's office, especially if you're sick, you know, you're not feeling well. Let's say you're staying home from work. I mean, who wants to drive 30 minutes? You're barely probably getting there in your pajamas. Also the hours of the location. Are they convenient for you? Are there after hours offered? Are there Saturday hours? Do they have, now with everything going on with COVID-19, the majority of places are offering telemedicine visits. So do they offer telemedicine visits such as phone visits or video visits? Other services that they offer. So can my blood get drawn there, and can I just get my labs done there? So like that one-stop shop. Are x-rays done there, or any imaging? Usually bigger imaging isn't necessarily done at a doctor's office. They may be located sometimes in a hospital building or medical building. They may be located next to an urgent care, so then you are able to get things done quicker because the convenience of those tests are closer. So that's something else you want to keep in mind. The other thing is, who is the doctor, physician, or provider affiliated with as far as a hospital? So if you have a hospital that if you get sick, and that's usually the hospital you go to if you get admitted or if you're having your baby, is that physician affiliated with that hospital? Because normally the communication is a little easier because the hospital knows that doctor and the doctor knows the hospital. So you do want to ask that, because it is a lot harder if you usually go to a hospital where the doctor isn't affiliated with, because then it may be harder to get medical records or find out about an ER visit or anything like that. So, you know, it just depends on your preference. And of course, talk to your friends and family. So find out from your friend, like, hey, who do you use for your pediatrician, for your kids? Do you like them? How's their personality? Find out, again, also from your family. Of course, there's surveys online. There's tons of sites that rate doctors, and people can go in and put in a review. The one thing about reviews that I don't like is, no matter what, people have a tendency that when they have a bad experience or when they're upset, that's when they do a review, no matter what it is, whether it's a restaurant, a doctor, whatever the case may be, a trip, you know, a hotel. Normally those are the individuals who are writing reviews. Of course, you have your handful of individuals that when they have a great experience, they'll definitely go on there. But most people have a tendency that if they want to complain about something, they will do the reviews. So I feel that reviews are sometimes skewed just because it's not capturing everybody, the general population who goes and sees, whether it's a doctor, a specialist, whoever it may be. So I would probably ask around instead of really looking at reviews online. You can, but I would really also just ask around. The next thing is, who covers if the doctor is out? So again, you want to see, does the doctor have partners? If there are no partners in the office, do they have somebody who comes into the office? Or if they do have partners, you know, you may at some point want to see one of the partners, so at least when your doctor, your regular doctor, is out, you at least know who they are and they've seen your history before, especially if you have a more complicated history. Some people just want to see one doctor and that's it. They don't even want to see anybody else, so they'll wait until the doctor comes back from vacation, and that's fine. Again, this is all just what is your preference, but again, just some questions to ask yourself when you're looking for the right doctor. And then, of course, the ease of getting an appointment. So some people who are healthy, when they call, if they're like, hey, you know, the wait to get in is about 2 weeks, they're fine with that. But, you know, some people are like, oh, yeah, I didn't make my appointment and I need to make an appointment within a week. Are those slots available? So that's the other thing that you want to ask yourself. And sometimes you really can't tell the ease of getting into an office until you are a patient. So that's when that one gets a little tricky. And of course, that's where, again, it's good to ask friends and family. If you're getting somebody's opinion, you'll be able to see if they're able to get in when they want to get in. And then of course, staff. So if when you're asking your friends and family, I would also ask about the staff, because staff is huge. There's been places where you can go in and the doctor is fabulous, but the staff is rude or impatient, you know, sometimes very abrupt. And of course, I totally understand. Most people come into the doctor's office, they're not feeling well, you know, they're not in the mood to not be treated kindly. So you also want to look at the staff, and if you get along with the staff, because it's nice to walk in and have somebody say, hey, Dr. Mushalak, how are you? Good to see you again. You know, it's nice and it's very welcoming. So you also want to take that into consideration. And again, if you are asking your friends and family for recommendations, it will be easy to hear from them how the staff are. And then finally, most offices do what's called, for pediatricians, do what's called a prenatal meet and greet. And for the adult population, family medicine and internal medicine, just a meet and greet. Obviously, we're not doing prenatal meet and greet. So on the ped side, what the prenatal meet and greet is, normally we recommend that moms, parents who are pregnant, that while you are still pregnant, that you go ahead and visit a pediatrician's office or multiple pediatrician's office, because one, you get to tour the facility, see the layout, see if it's, you know, I personally like a clean office. Also, you get to meet the staff. Again, it's brief, but at least you can get a sense. I think overall you can get a sense if somebody's smiling with you or if they're serious and just staring at you. So you can get if the mood is welcoming. And then of course you can meet the doctor or doctors who are there and kind of feel out the personality. See if that personality matches you, see how the ease of communication is, how the interaction is during that time. Now remember, in a prenatal meet and greet or a meet and greet, this isn't a session, this isn't a consultation session, so you don't get medical advice. So don't think you're going there to say like, hey, when my baby comes, if this happens, what are you going to do, or what should I do? That's not the point of it. The point is for it to be a meet and greet, to introduce yourself, and again to feel out personalities and the interaction between you all. And then of course on the flip side, with the adult visits, you can go, same thing, feel out the communication, the interaction. And again, I am a firm believer, personally how I practice, I really do enjoy teaching my patients and my patients' parents about the diseases that their family members or they themselves have, so they can understand what is going on in their bodies, why, whatever treatment we're doing, why we're doing it. Because I feel patients are more compliant that way because they understand the reason. And you know, it depends. Some people, again, I'm more laid back. I really enjoy building a rapport with my patients, asking about, you know, what they do, how their kids are, how old their kids are, what their kids are going to do when they grow up. You know, so I really do like building that rapport. Every physician isn't like that. Some physicians are just like, hey, you're here for this, let's take care of that and move on. And some people prefer that. Some people don't like small talk where you're like, how's it going? How was work? How are things now with COVID-19? Are you surviving, staying at home? And you know, now that we're getting out, you're doing okay with that? I mean, some people don't even want that. So my personality may not necessarily fit somebody else's, what they're looking for. And again, somebody may not want to, hello, I'm Dr. Mushlak, that they may not necessarily want somebody like that. So it really just depends. And so again, I really do feel that connection as far as personality is very important, because then you truly know that that doctor cares and is sincere. So that's important. And then the other thing is just the ease of communication. So most patients and patients' parents are already slightly intimidated. They're coming to the doctor's office, and sometimes we're guilty of, using medical terms that people may not necessarily understand. And some people may be too intimidated or too shy even to say, what does that mean? And some people may just nod their heads and act like they understand, but they really don't. You really want to have a provider that you are able to ask questions to and get a response without feeling like you're bothering them, and that they take the time to explain things if you need things explained. So that's very important, the communication and the ease of communication, because again, part of our job is, of course, serving people, taking care of people, but also educating. And that's part of why I do the Dr. Mom Show, is so that I can help educate people and parents out there to have better interactions with their physician or their child's physician. So again, and as far as these meet and greets, you can go ahead and call the offices. These visits should be at no charge for you, the meet and greets. That's why I brought up it is not a consultation. But again, it's a good way to get in there, kind of feel things out, feel the people out who are in that office. So again, I hope this was helpful. If you do not have a primary care physician or your child does not have a pediatrician, you for sure should have a primary care physician. And I always say keep up to date with your checkups, and definitely do well with that, because a lot of times we can find things just with those checkups. So again, I hope this was helpful. I hope you guys continue to stay safe. I know there's a lot going on. I continue to pray that there will just be healing in our nation on multiple levels. And again, you guys, don't forget to wash your hands, kiss your kids, love your families, and say your prayers good night. And also don't forget to check me out on Facebook Live, Deleen Mushalak, on Saturday, this Saturday, June 6th at 10:30 a.m. Eastern Standard Time for Women of War, Peace in the Midst of the Storm virtual book launch. All right, love you guys. Take care. Bye-bye.